So we are going to see today the chest wall. So you can see the chest wall here, the left side of the chest wall, where you can see the ribs, you can see the sternum, and between the ribs you could see the intercostal space, where on the lateral side here you can see the fibers here, the direction of the fibers. These fibers are running antero-inferiorly, so these are the external intercostal muscle. Now on to this side here, you can see some fibers here. These are the muscles where the fibers are running opposite direction as that of this muscle. So here it is running antero-inferiorly, here it is running postero-inferiorly, and these are the muscles called internal intercostal muscles. Onto this side here, you can see this part. Somewhere here, this is sternum, xiphoid process. So this area, I have removed some part of this fascia here. This is called the. So in this side, you can see rectus sheath. I have removed the rectus sheath to expose this muscle here, the vertically running fibers. These are the rectus abdominis muscle. Next, we are going to cut the ribs here, laterally, upper part, and we have to remove the clavicle from the sternum. So we have removed the clavicle here. Again, on this side, we have cut the ribs. So when you cut the ribs like this, we can remove the anterior chest wall in this way. So right now you are seeing the anterior chest wall, posterior view of anterior chest wall. Now we have cut the anterior chest wall and we have reflected it. Here you can see posterior aspect of anterior chest wall. You can see the sternum. You can see the ribs here. You can see the intercostal spaces. And near the costal groove, you can see some structures here. These structures are called intercostal nerves and vessels. On the posterior aspect of the sternum here, little bit medially, you can see some structures here. These are the internal thoracic vessels. This is artery, the white one, and this blue one is internal thoracic vein. So this is internal thoracic artery, this is internal thoracic vein. This is the endothoracic fascia, which is covering the inner aspect of the ribs. In the costal groove, we can see some nerves here. These are the intercostal nerves. And onto the sternum here, you can see some muscles here. These muscles are called sternocostalis, which are attached to the ribs and the sternum. Now this area, we can see the lungs, two lungs covered by pleura, and in between you can see the pericardium. And here, this area, this is the diaphragm, thoraco-abdominal diaphragm. Now the whole area here, this part, is called the mediastinum. So mediastinum is a septum that is between the two pleural cavity. So this is the mediastinum. And here you can see a structure, that is the pericardium. Pericardium has got two layers, a fibrous pericardium and a serous pericardium. Serous pericardium is lying inner to fibrous pericardium. Serous pericardium has got two layers. It has got outer layer and an inner layer. So once you cut the fibrous pericardium here, you can see this. This is the glistening part that you can see here. That is nothing but the outer layer of serous pericardium. Whereas the inner layer of serous pericardium is attached onto the surface of the heart. So this is the heart here. You can see the heart. Wait a minute. The fibrous pericardium is a thick layer that you can see here. Now pericardium has got a base that is towards the lower aspect and the apex. So base of the pericardium that is attached to the diaphragm. So this is the diaphragm here. So here you can see the pericardium that is closely attached to the diaphragm. Diaphragm has a portion here that is called the central tendon of the diaphragm. So central tendon of the diaphragm and the pericardium, they are blending with each other. Now, the pericardium has got a base and a apex. I mentioned already that the base is attached to the diaphragm, whereas the apex will continue upwards. It will be covering the root of great vessels. So you can see here, this is the pericardium. Once you reflect it, you can see it is covering the root of great vessels. These are the great vessels here that you can see here. Now these are the lungs, left lung, the right lung. We can see the sharp border here of the lung here, that is the anterior border. This one. Anterior border is short and it is very sharp. So here you can see the anterior border on the right side. So anterior border of the lungs, they are going to cover the pericardium, the heart, like this usually. But here on the left side, you can see a notch which is formed here. This is called cardiac notch. So cardiac notch is nothing but it is a deviation of the anterior border of left lung towards the left. So because of this cardiac notch, the heart is exposed to the posterior aspect of the sternum. So this part of the heart where the left lung is not covering the heart is called as the area of superficial cardiac dullness. Now on the lung you can see that this area, this is part of endothoracic fascia. Also the parietal pleura can be visualized on the surface of the lung. That can be seen as here also. So the endothoracic fascia and the parietal pleura can be easily seen on this area. Visceral pleura is attached to the lungs and cannot be removed from the surface of the lung. Now look at this area. This is the heart. So this surface of the heart is called sternocostal surface of the heart. So here we have taken one more heart to show the sternocostal surface. So this is the sternocostal surface here. And this area of the heart, that is this area of the heart, is called the apex of the heart. So this is the apex of the heart. A heart and the pericardium, these are the structures that you can see in the middle mediastinum. Now let's see some of the structures here that you can visualize. Here we can see this structure here. This is the anterior interventricular artery, which is a branch of left coronary artery. Now this artery which is running in anterior interventricular groove, that can be seen. Now this area, we can see this structure here, the big structure here onto the right side. So this is here aorta, ascending aorta, and this is the arch of aorta. Now here, just to the left side of the aorta, here you can see the structure. This is pulmonary trunk. So here, this is the right ventricle. Right ventricle is a triangular shaped structure. The apex of the triangle is going to continue as pulmonary trunk. Now to the right of aorta, here you can see this structure here, this one. This is superior vena cava. Superior vena cava is draining into the right atrium. So here this surface here you can see this part. This is the right atrium. You can see the superior vena cava is draining into the right atrium. And this is the surface of the lung, called medial surface of the lung, which is facing the mediastinum on the right side. Here you can see the surface of the left lung, which is facing the mediastinum. So this is right side and this is left side lungs. Now look at this area here. You can see this area where Some structures are connecting the lungs to the mediastinum. So this is called the root of the lung. So here you can see a structure which is running in front of the root of the lung. This nerve is the phrenic nerve. So this is right phrenic nerve. Similarly, when you go onto the left side here, you can see this area here, a nerve. This nerve is also running in front of root of lung. So this is called the left phrenic nerve. Phrenic nerve supplies the diaphragm. There are two sinuses that you can see within the pericardium, which are called pericardial sinuses. The first one is called transverse pericardial sinus. So transverse pericardial sinus is located behind the aorta and the pulmonary trunk in front of superior vena cava. So to get the transverse sinus, you need to put a forceps, or you can just put your finger. So I'm just passing my finger behind the pulmonary trunk and the aorta. So I hope you can see the tip of my finger here. This one. Now my finger is in front of superior vena cava, but behind the aorta and the pulmonary trunk, and this is called transverse sinus. So I'm going to put a forceps into the transverse sinus. This is transverse sinus. Now there is one more sinus that you can see here. For that you need to lift the heart. Now I am putting my finger to visualize the next sinus, that is called oblique sinus, which pull the heart and place your finger beneath it. Now my finger is going towards the oblique sinus. The oblique sinus is placed behind the left atrium. Now it is a sinus which is bounded on the left side by the left pulmonary veins and right side by right pulmonary veins. So this is the oblique sinus where I am putting my finger. So this is another cadaver where we have removed the anterior chest wall. We have cut the anterior chest wall almost. Now we will see some of the structures here. On this side here, you can see the ribs here. In between the ribs, you can see some fibers here. These are the external intercostal muscle. Now here, medially, as you go, you can see some muscle fibers here. These are the internal intercostal muscles. Look at the direction of the internal intercostal muscle and look at the direction of external intercostal muscle. External intercostal muscles, the fibers are running antero-inferiorly, whereas here the fibers are running postero-inferiorly. Now we are going to open the chest. Before that, let's see one more muscle here, this muscle. This is a muscle, big muscle here, that is rectus abdominis muscle. Open the anterior chest wall. Now here you can see the posterior aspect of anterior chest wall. You can see some of the structures here. This one. This is internal thoracic vessels. And these are the muscles called sternocostalis muscles, which are attached to the sternum and the ribs. And this glistening area is the endothoracic fascia. Thorax, where you can see the organs. Lungs can be seen. Pericardium and the heart. Also you could see this area here. This is diaphragm. So this is the right lung, this is the left lung, that can be seen nicely, and this is the pericardium. So you have reflected the pericardium in this also. So we can see the heart, right ventricle, left ventricle, and this is right atrium. Also you can see some of the structures, the big vessels. This is the aorta, this is pulmonary trunk, and this is superior vena cava. Now when I reflect the heart upwards, you can see this white area here, and this is called the central tendon of diaphragm. So this is the diaphragm here, whole area is diaphragm, and this area is called the central tendon of the diaphragm, where the pericardium is blending with the diaphragm. Now in this we will try to find out the transverse sinus. So this is the transverse sinus, where I am putting my finger behind the aorta, pulmonary trunk, and my finger is coming anterior to superior vena cava. So this is transverse sinus. So I am going to put my forceps in the transverse sinus. Now let's see the oblique sinus. So I am going to put my fingers beneath the heart. So when I put my finger beneath the heart, I am entering to the oblique sinus. So this is the oblique sinus. Oblique sinus is placed behind the left atrium. And here you can see it is bounded to the left by the pulmonary veins. So you can see the pulmonary veins here, which are forming the boundary for oblique sinus. So somewhere here is the oblique sinus. So when I move laterally, my fingers are touching the pulmonary veins. My fingers are restricted by pulmonary veins on the left side. Similarly, on the right side, my fingers are restricted by the right pulmonary veins. And that is the area where you can see the oblique sinus. Now my finger is in the oblique sinus. You can see that the sternocostal surface of the heart is usually covered by the two lungs. But here on the left side, you can see the anterior border of the lung is curved, and this curve here is called the cardiac notch. So because of the cardiac notch, the sternocostal surface of the heart is exposed to the sternum. So this is called superficial area of cardiac dullness. This is the anterior border of the left lung, which is taking a deviation to the left. That is called cardiac notch. Similarly, here you can see the anterior border of the right lung. Here the anterior border of right lung is straight. There is no cardiac notch here. So it is straight and it is pointed. So anterior border of the lungs are pointed, sharp, whereas posterior border is rounded. So this is the posterior wall of the trunk. This is the thoracic aspect and this is the abdominal aspect. Now here, this is the midline where you can feel the vertebra, and these are the ribs here. These are the ribs. Here you can see the ribs. So there is a rib here and there's a rib here. These two are the ribs. And in between that you can see a muscle here. Look at the direction of the muscle fibers. These are running downwards and anteriorly. So antero-inferior direction. Here also you can see antero-inferior direction, and these are the external intercostal muscles. Now we are going to make it upside down here. Now let's see the structures. See, this is the thoracic region, thoracic cavity, and this structure here, a dome shaped structure here, that is diaphragm, and here this area is the abdominal cavity, and at the center we can see the vertebra. You can see a cross section of the vertebra here. You can see this is the thoracic vertebra here, and here you can see the vertebral canal, transverse process of the vertebra, the spine of the vertebra, and in the vertebral canal you could see the spinal cord, a cross section of spinal cord. So this is the thoracic vertebra. You can see the body of the thoracic vertebra, transverse process. These are the pedicles and these are the laminae. This one is the spinous process. So when you take a cross section, you can see like this. this area is the body of the vertebra here, and this area is the vertebral canal. So you can see the vertebral canal, and this is transverse process, spine. The spine can be seen here, the spine, transverse process, body of the vertebra, and in the vertebral canal you can see the section of the spinal cord. Also you can see the transverse process. Now moving on to this area here, the thoracic cavity. You could see this area, this cavity here, a depression here, is called the paravertebral gutter. So here you can see a lot of structures. The main structure which is going to be here is a lung, a posterior aspect, posterior border of the lungs. Here the center you could see some structures, that is this structure here, which is a tube, that is called the esophagus. Now here, just in front of it, you can see some part, cross sections or sections of trachea, and here to the left side of esophagus, here we can see this part, this structure. This is the aorta. So you can see a part of the arching of the aorta. Then, so arch of it is cut here, but you can see the descending thoracic aorta which is running, and it is going to pierce the diaphragm. Now here, some other structures also can be seen. You can see this nerve. This nerve is going along with the esophagus, that is called the vagus nerve. So vagus nerve forms esophageal plexus. Now here to the right side you can see a vein. This vein is called the azygos vein. Azygos vein will drain into superior vena cava, superiorly. Now this is, you can see some nerves here, some of the structures here, some nerves and vessels. So these are the intercostal nerves. This is intercostal nerve, and this is intercostal vessel, that also can be seen in the intercostal space. So you are weaving the intercostal space from inside. Again on this side, here you can see some of the nerves. These nerves, or this is called the sympathetic trunk, thoracic sympathetic trunk, which are running on either side of the body of the vertebra. So this is the sympathetic chain. Now this is the diaphragm. So you can see the whole diaphragm here. Diaphragm is like a dome-shaped structure, something like a parachute. And here, anterior aspect of the diaphragm, you can see this white area, that is called the central tendon of the diaphragm, where the pericardium is going to blend with the diaphragm. And you can see a lot of openings on the diaphragm. Here near the central tendon you can see an opening here. This opening is for the inferior vena cava, and this is for the esophageal opening. Esophagus will pierce the diaphragm. Also the aorta will also pierce the diaphragm. So there are major 3 openings in the diaphragm. So the first one is inferior vena cava, which is at the level of 8th thoracic vertebra, this one. Then at the level of 10th thoracic vertebra, esophagus pierces the diaphragm. At the level of 12th thoracic vertebra, descending thoracic aorta will pierce the diaphragm.